Hello everyone, this is Mrs. Curry again. Welcome to week 14 lecture, and this is going to be the last week of lecture, and I hope you enjoy it and study well for the next exam. We will be discussing about care of children with hematological conditions and cancers this week. Thalassemia, this is the inherited autosomal recessive condition that results in a deficiency of alpha or beta globin protein needed for the production of hemoglobin. So whenever there is a condition, I want you to remember some conditions are autosomal dominant, some are autosomal recessive. Thalassemia is autosomal recessive. So certain conditions I might have discussed in the past too. So if that says if it is autosomal recessive, I want you to know that. Then it is the most common inherited genetic disorder in the world. The signs and symptoms are: symptomatic children with beta thalassemia have enlarged liver and spleen, mild jaundice, growth retardation, moderate to severe anemia, increased risk of infection secondary to splenomegaly or splenectomy. And the diagnosis is based on history and physical examination and lab tests. The lab tests include those that quantify or describe hemoglobin, example like CBC with red cell indices. The lab often reveal decreased hemoglobin and hematocrit. Hypochromia, the chrome describes the color. So hypochromia means low color in the hemoglobin. And the microcytosis, that means the cell is smaller in size. So the anemia in thalassemia will be hypochromic microcytic anemia. Okay, so remember that. And there will be low mean corpuscular volume, that is the MCV will be low, and increased reticulocyte count. The nursing care includes prevent hypoxia by providing blood transfusion therapy, like every 3 to 4 weeks the child may need for almost a lifetime. And be aware of the risk for hemosiderosis due to chronic transfusion therapy. Children with beta thalassemia may be cured for disorder with bone marrow transplant. And education and discharge instructions include emphasize the importance of blood transfusion therapy and chelation to ensure adherence with treatment and regimen to promote quality of life. Education and discharge instructions include teach family appropriate techniques for administration of chelation therapy, emphasize meticulous hand washing because children with thalassemia are often asplenic, insist that parents must seek medical attention if child develops temperature of 1.5 degree, instruct family on importance of genetic counseling, and refer to community resources for support. Hemophilia. It is the most common group of hereditary bleeding disorders caused by a deficiency or absence of factor VIII, that is the hemophilia A, or factor IX deficiency, which is hemophilia B, and plasma proteins required for normal blood clotting. The signs and symptoms are: most children are free of symptoms until they start crawling or walk, because once they start crawling and walking, they bump into something, get some scratches, bruises and all that. That is the time you will see excessive bruising. So till then you may not notice anything because they are still almost like still. Then excessive bleeding after circumcision or after tooth loss, then oozing after a circumcision, intracranial hemorrhage in neonates as a result of childbirth, because when the child's head is pass through the vaginal canal, there because the head gets compressed, right, and you will see the overlapping of the sutures, molding, all that. So there is a possibility of intracranial hemorrhage in neonates during this birthing process. Then soft tissue bleeding, swelling or stiffness of joints, especially knees, decreased range of motion of extremities, painful joints, and the diagnosis is made by like testing is warranted for children who experience moderate to severe bleeding from minor procedures or bleeding into large joints. So then you have to be careful when we need to test them on any factor 8 or factor 9 deficiency. Common diagnostic tests may include prothrombin time, partial thromboplastin time, and direct assay of plasma factor activity level for hemophilia A and B. The types and classification are confirmed by type of factor deficiency and percentage of factor level in plasma. The nursing care is collaborative and interdisciplinary. Initiate prompt treatment of bleeding episodes. Ensure deficient factors are properly identified, so proper replacement factors are administered. Focus on patient safety, prevention of complications, and promoting wellness and quality of life. And recombinant factor products are the main treatment for hemophilia. Education and discharge instructions include prophylactic dose of factor products may be administered at home. Collaborate with family on safety precautions. Teach signs and symptoms that require prompt medical attention. Instruct family members on how to administer recombinant factor products by intravenous access. Older mature children may self-administer factor products at home and after instruction has been completed, because they are, if they are mature enough to understand and comprehend, and we need to teach the skills. Encourage medical ID bracelets to be worn, because if there is an emergency, we know that this patient has hemophilia, so it should alert the medical team. Acute lymphocytic leukemia. It is otherwise known as acute lymphoblastic leukemia. It is a rapidly progressing disease that affects mostly immature, undifferentiated cells that are not able to perform their normal functions. And it is the most common type of cancer in children. Signs and symptoms are, the presenting signs and symptoms vary widely depending on degree of infiltration. Onset usually acute, but signs and symptoms may appear slowly. Fever occurs in almost 50% of the cases. Fatigue and lethargy, paleness due to anemia and anorexia. More than one third of the children may be present with bone or joint pain, and parents may notice limp or child may refuse to walk. The less common symptoms include headache, vomiting, difficulty in breathing, low urine output, bleeding under skin or in mouth or eyes, petechiae, abdominal distension caused by enlarged spleen, enlarged lymph nodes present in more than 50% of the patients. Hepatomegaly may be present. And the diagnosis is based on CBC and other blood tests. Evaluate the WBC count, platelets, liver and kidney function. Bone marrow aspirate required to make a diagnosis of acute lymphocytic leukemia. And it is confirmed by finding if more than 25% of abnormal lymphoblast cells, then you would diagnose it as ALL. And other samples in bone marrow is tested further for any chromosomal changes and better identify specifics of leukemia. There are so many other, there are pre-B lymphocytic leukemia. There are something like Philadelphia chromosome, presence of Philadelphia chromosome, which if there is a presence of Philadelphia chromosome, then there is a slow it's a poor prognosis. So further testing is done to find the specific of the leukemia. White blood count and age at diagnosis, most important prognosis signs. It is believed that if the children are diagnosed between 5 and 10 years, it's a better prognosis, and after 10 years, it is not that good prognosis. Lumbar puncture for presence of CNS disease and staging, that is, if it is in more advanced stage, there can be CNS involvement. Those who have CNS involvement, they may need intrathecal methotrexate therapy as well as radiation. So you wanted to know if there is CNS involvement. Chest radiograph detects mediastinal mass. Laboratory findings show liver or kidney involvement. And the collaborative care leukemia is treated with chemotherapy, as you all know, includes 3 phases: remission induction phase to reduce the tumor to undetectable size. The most common medications which used are vincristine or vincristine, L-asparginase, and prednisone or dexamethasone. Those, remember, we discussed the use of dexamethasone as part of chemotherapy when we discussed the drug cards. And those with worse prognosis also given with arthrocycline drugs, CNS prophylaxis via lumbar puncture, and also radiation is also used. Consolidation phase is destroy any residual leukemic cells. Chemotherapy administered in high doses and radiation may be required. So in the induction phase, but you don't want to see any more blast cells, so there should be 0 cells in the induction phase. Then only we consider the induction phase is successful. So in the consolidation phase is like more intense therapy is administered, and radiation may be required depending upon CNS involvement and all that. The maintenance is to control leukemia. It can last 2 to 3 years after diagnosis and usually carried out in the outpatient setting. Children with second remission after relapse may undergo bone marrow transplant, and biological therapy may be used to prevent or treat damage to other body systems caused by other leukemic treatments. Basic care of children undergoing chemotherapy includes focus on reducing risk of infection because they're very immune suppressed. So they are very prone to get infections. So we need to prevent any chances of getting infection. Monitor vital signs, record lab values, administer antibiotics and antifungal medications. These children during chemotherapy, they go on chronic use of antibiotics and also antifungal medications like nystatin solutions. We need to tell them when they use nystatin is like swish and swallow of antifungal medications such as nystatin, so that the oral cavity and the GI tract is covered with that. Neuroblastoma. It is a tumor of nerve tissue that develops in infants and children from the tissues that form the sympathetic nervous system, and most commonly develops in the abdomen within the tissues of the adrenal gland, but may also occur in the brain, pelvis, mediastinum, and sympathetic ganglia. The signs and symptoms: wide variety of initial symptoms depending upon primary site of the tumor. You may feel a hard, painless mass in the neck or abdomen, usually detected by palpation. And the masses of thorax can be seen on radiographs, usually an incidental finding on film done to rule out pneumonia. And possible edema of legs related to vascular compression, bone pain if widespread metastasis to bones, skull and orbital bones frequently affected, swelling and bruising common around the eyes. And the diagnosis is made by imaging studies like MRI and CT scan may indicate the presence of mass. Clear diagnosis can be made only by biopsy. Bone marrow aspiration may be performed. Labs may be used to measure level of secreted catecholamines or catecholamine metabolites in urine, like vanillyl mandelic acid, like that is VMA test, and homovanillic acid HVA test. The treatment is determined by stage of disease and child's age. Initially, surgical resection is performed, followed by chemotherapy, and in advanced stages, complete surgical resection is not always possible, and chemotherapy is initiated. And radiation is done, but it is not curative if it is used alone, and it is used for tumor control and used with chemotherapy, and autologous or allogenic bone marrow transplant also is done. We need to perform a complete nursing assessment to ensure no infection is present and condition remains stable, and provide comfort and alleviate pain. Support child and family during diagnosis and treatment phase. Encourage child and caregivers to share feelings about disease process and related treatments. Provide accurate information and education. Teach parents to monitor the incision sites for signs of infection and watch for fever. Emphasize avoiding large crowds and ill people during the treatment phase, and teach comfort measures. Wilms tumor, or otherwise known as nephroblastoma, these are the tumors that originate in one or both kidneys. The signs and symptoms are abdominal mass, usually painless, usually discovered at a routine physical exam or by family member during bathing or routine care. So, unlike in neuroblastoma, mass frequently presents on one side. I must have told you this in clinical teaching. In neuroblastoma, the abdominal mass is usually crossing the midline of the abdomen. So, you may feel as a big mass crossing the midline of the abdomen. But in nephroblastoma or Wilms tumor, it is usually limited to one side. I want you to remember that. So this is why very important in every physical examination when you do as a neonate or every pediatric visits, we need to palpate the abdomen for any masses if it is present or not. So that is how most of the time a neuroblastoma or a Wilms tumor is diagnosed or suspected at least. These signs and symptoms occur infrequently are hematuria, hypertension, pain, and other signs and symptoms may include aniridia, that is absence of iris, that is the colored part of the eye, hemihypertrophy, that is an increased size of half of the body, urinary defects such as cryptorchidism and hypospadias. But these are like not always present. It might be present. Diagnosis is based on presence of abdominal mass and lab test findings, urine and electrolyte analysis, CBC, renal or abdominal ultrasound or CT scan or MRI of abdomen, chest X-ray if metastases are suspected. And the collaborative care is complete, thorough health history and nursing assessment, provide food high in calories and protein, and if the child is unable to eat or meet basic caloric requirements for growth and development, then try dietary supplements, allow child food choices, provide food textures that might facilitate eating, enteral or parenteral feeding may be provided if necessary. Never palpate the abdomen. This is what you have to remember, like once you suspect, for a diagnosis purpose, you may palpate it, but after you diagnosis, then don't palpate the abdomen and place a warning sign on child's hospital room door that is no abdominal palpation. I remember this when I worked in the pediatric cancer units years ago, and I was a student at that time. So there were so many child's beds had the sign that do not palpate the abdomen, so that people don't palpate and keep palpating, for the studying purpose and all that, and there is a possibility that you may rupture it. So that is why do not palpate the abdomen after you diagnose the case. The management is done by chemotherapy and radiation. The most common chemotherapy drugs used in Wilms tumor are actinomycin D and vincristine. For tumors in more advanced stages and those with unfavorable histology or those that recur after treatment, the following drugs can be used, like doxorubicin, cyclophosphamide, etoposide, irinotecan, and carboplatin. After removal of the mass, usually involves taking the entire kidney, that is the nephrectomy is done. That's the usual procedure for this Wilms tumor, and postoperative care similar to care of children undergoing other abdominal surgeries. Perform postoperative assessment of remaining kidney to ensure function. Closely monitor urine output for amount, color, clarity, presence of clots, pain, and laboratory values. And education and discharge instructions include teach parents to monitor incision site for signs of infection including fever, emphasize awareness of child's nutritional intake and bowel movements, stress importance of follow-up appointments and clinic visits. Osteosarcoma. Osteosarcoma or osteogenic sarcoma is a bone tumor that usually occurs in the metaphysis. The metaphysis is the growing portion of the bone. The long bones are more frequently affected than the flat bones such as pelvis or skull. Signs and symptoms are pain and swelling. Pain increases with activity and weight bearing. Pain may cause child to limp. Dull aching pain commonly exists for months before diagnosis. Palpation at site of disease often reveals tenderness, swelling, warmth, and erythema. The diagnosis is made by X-ray of the film, may include sunburst pattern of affected bone, and the child chest X-ray exam performed to check for metastasis, MRI of entire bone to evaluate extent of tumor, nuclear medicine scan or bone scan may be done to determine extent of involvement in the bone. The nuclear tracer isotopes, example like technetium-99m or thallium-201, show increased uptake of radioactive material in areas of primary tumor and areas of metastasis. The lung is the most common site of distant metastatic spread. The diagnosis is done by certain lab tests. Example, elevated blood levels of alkaline phosphatase or lactic acid dehydrogenase is helpful in making diagnosis, and final confirmation is made only after biopsy with microscopic examination. The collaborative care, monitor and treat pain, use age-appropriate pain scales to assess pain, use both pharmacological and non-pharmacological pain relief measures. Promote function and mobility. Chemotherapy used first to shrink tumor, and after chemotherapy, surgical resection of affected bone performed. Monitor surgical sites for redness, warmth, and signs of infection. Monitor vital signs. Perform ongoing nursing assessments. Provide adequate pain control. Monitor for signs and symptoms of infection. And provide emotional support for the child and the family. Education and discharge instructions include emphasize importance of monitoring mobility, function, and pain after surgery. Educate family on possibility of needing amputation and prosthesis. Tell family that child can resume normal activity depending on treatment protocol and how child feels. Teach parents about quiet activities that integrate normal developmental socialization. That is all about this week's topics, and that comes to the end of all lectures of this class, and thank you for listening. Good luck for your exams and your future classes and your future career, and I enjoyed working with everybody. Thank you so much.